Welcome to eCareDiary.com's Caregiver Tips and Clips. I'm your host Meghna Kiridhar. Each week we will focus on a caregiving issue in the form of a short educational video. The subject of today's video is alcoholism among the elderly. Alcoholism among seniors is a healthcare issue often hidden or overlooked. Alcohol abuse often goes undiagnosed because older people are often less social. Doctors may not link symptoms that are also common signs of aging, such as falls, failing memory, sleep problems, or depression to alcohol abuse. According to the National Council on Alcoholism and Drug Dependence, 6 to 11% of all seniors admitted to hospitals exhibit symptoms of alcoholism. 20% of all elderly patients admitted to psychiatric services exhibit symptoms too. 14% of all elderly patients in emergency rooms also exhibit symptoms of alcoholism. Drinking in nursing homes is as high as 49%. Almost 8 million older adults abuse alcohol and drugs. Less than 2% of all admissions for alcohol and drug treatment are for people over the age of 55. 80% of all senior admissions were for alcohol as the primary drug. One of the main concerns regarding senior alcoholism is that they are unaware of how it reacts differently to their bodies as compared to younger people. With age, the same amount of alcohol can have a greater and more damaging effect on a senior's body. Drinking more than recommended quantities can hamper judgment, causing falls, fractures, and car crashes. Drinking too much can worsen health issues such as osteoporosis, diabetes, high blood pressure, and ulcers. It's not uncommon for older people to get confused after heavy drinking. Heart and blood vessels can undergo changes and can trigger heart attacks. Heavy drinking over time can also cause certain cancers, liver damage, immune system disorders, and brain damage. In addition, many prescription over-the-counter medicines and herbal remedies are lethal when had with alcohol. For example, aspirin can lead to bleeding in the stomach. Liver damage is possible when alcohol is used with painkillers. Cough syrups and laxatives also have high alcohol content. It is untrue that all seniors who drink every day have a problem. Similarly, it is also not true that problem drinkers drink every day. Here are some helpful signs to look out for if there are concerns about an elderly loved one suffering from alcohol abuse. Seniors who abuse alcohol drink to calm down or feel happy. They have more than one drink a day. They often lie about drinking habits and get upset when questioned. They are frequently irritable or resentful when sober. Most of them also face medical, social, or financial worries due to drinking. Help is available if a senior wants to address alcohol abuse. The first thing to do is acknowledge the problem with your family and enlist their support. Next, talk to a doctor, local health department, or social services. Support groups or group therapy for those with alcohol problems are also helpful. At home, restraint can be practiced by counting the number of ounces contained in each drink. One should also keep track of the number of drinks consumed in a day. Making sure regular meals are consumed while drinking is also recommended. To divert the mind away from drinking, it's important to develop hobbies and not socialize with those involved with drinking. Keeping the mind and body healthy with regular exercise is great. There are many types of treatments available. These include the 12-step help program, detoxification, that is getting alcohol out of the body, taking prescription medicines to help prevent a return to drinking, and individual or group counseling. The National Institute on Alcohol Abuse and Alcoholism, which is part of the National Institute of Health, recommends that people over age 65 should have no more than 7 drinks a week and no more than 3 drinks on any one day. Here are some additional resources to help seniors and caregivers. April is Alcohol Awareness Month. Even if there are no intentions of hurting anyone, alcohol can cause tremendous damage to the mind, body, and soul. Be aware of changes, make adjustments to the amount of alcohol consumed to ensure a life lived to the fullest. Thank you for joining us today. To access more caregiver tips and clips, visit us at www.ecarediary.com. Until next time.